To start with, many women tend to come to see us gynecologists at a time when they have become pregnant. And unfortunately, some even come way late. They are 6 months, they are 5 months, because really a woman should come when the very time they get to know that they are pregnant. But if there is anybody that has, you know, a plan to conceive and to have a child this year, then you need to start earlier. You really need to start earlier. We say at least 3 months before you conceive, you go and see your gynecologist and you discuss through. Tell them, I want to become pregnant. What advice do you have for me? So we start by having a chat with the woman, asking them, because we want to find out, do you have any health condition pre-existing? It could be diabetes, it could be high blood pressure. We want to find out those, because they will affect your pregnancy later when you conceive. So we want to find out those. We want to find out if you are using any drugs chronically. They could be for any chronic disease. Are you having any chronic disease and you are using this drug? Because if you conceive, certain drugs can affect the baby as the baby grows in the mother's womb. So we want to find out those things. Then we want to know about your nutrition status. How are you eating? How are you having a balanced diet? Are you having vitamins? Because at one point even we shall need to give you some supplements of vitamins. We'll give you folic acid during this period as you prepare to conceive. Then we want to find out how is your lifestyle. Do you do some exercises? Because these are also very key. You do some exercises. Maintaining a healthy body is very key for the mother to be. Because once the body is healthy, then the baby will be healthy as they grow inside the womb. So we are going to try to find out all these things. And then, as I said, we shall give you some vitamins for you to have to start way long before you conceive. Then we shall screen you. We need to check your blood level, because if a woman has a low blood level, still it will affect her pregnancy. So we need to check your blood level and advise you accordingly. We need to screen you for any other infections. Could you be having this infection? And then we treat it. Maybe you didn't know. It could be a urinary tract infection. It could be a sexually transmitted infection. Then we treat it so as to keep you healthy. Then we still go to vaccination. There are some vaccines we encourage people to have. Have you been vaccinated for hepatitis B? We need to find out that. If not, then can we get you a vaccine? Because we know that that infection can still affect the baby if you become pregnant. So we need to take a woman through all these. Check your lifestyle. Are you a person who likes drinking alcohol a lot? A person who likes smoking? Then we need to advise you to stop all those, because they will affect your baby, or they can even cause you a miscarriage in case you conceive. So all these, if there is any woman planning to conceive, you need to go and see your gynecologist early, have a discussion through these, have the necessary tests done. Where vaccination is needed, you get vaccinated, and where you need treatment, you get the treatment, so that by the time you conceive, then you will have a healthy pregnancy, which will result into a healthy baby.
Excellent. Thank you so much. And of course, you've shared lots. Now, when should this begin? At 2 months, at 1 month before I get pregnant, at 6 months? When should I begin this?
Yeah. So this should come at least 3 months.
3 months prior.
Yeah, at least 3 months prior, so that we can have all these things done, and then treatment where needed, and then getting your vitamins, folic acid, so that they are started a little bit earlier for you to be well prepared for the pregnancy.
Now, we've spoken about the woman who is preparing to be pregnant, but of course we are forgetting the man who is the source of the power. How do you prepare men in this regard?
Yes, very good. And it's actually always necessary and important for a man to come with the woman, because these are the ones who are going to form the family, to have the child. because apart from the health issues, in particular medical issues, there is a lot of social issues that go on. This woman who is planning to get pregnant needs social support. We want to know, as a man, how prepared are you to help this woman or your wife? Financial support, emotional support. Because once she gets pregnant, a lot of changes are going to come in. She'll, a lot of emotions. Sometimes she'll be depressed. Sometimes she'll, be angry. Sometimes, she'll not want to look at, people and all that. So the man is very key also to be taken through this counseling. And now also, as I talked about the woman screening for infections, it will be important. Screen for some infections also in a man. Okay, screen for maybe HIV, still screen for hepatitis B. Some of these infections actually which are sexually transmitted, because once the man has it, then it will go to the woman as well. But also the blood group, know the blood group of the woman and also know the blood group of the man. Because there are sometimes when we talk of a blood group for a woman, and then we definitely need to know how the man is. So it is really very, very important. But still, the man also, how healthy are they in terms of, any other chronic diseases they could be having? Do they have diabetes? Do they have high blood pressure? Because much as that may not affect the baby directly, but they may affect the man's ability, the man and the woman to have a baby. So they may affect fertility, in other words. So the man is also very important to come into the picture as we prepare for pregnancy.
Wow, thank you so much, Dr. Elisa. Dear viewers, of course, we want to once again welcome you to our Health and Beauty Program 2026. Our theme for this year is actually being healthy is a choice, but remaining healthy throughout the year is a chance, because we cannot predict the future. That's why we've brought you the women's health specialist. And of course, we are now tipping women. And of course, women must come along with men if you're married, so that your health is full to the brim. And we are still talking about preconception. For the persons considering pregnancy, for those who have confirmed with their partners, if you've confirmed with your partner, what should you do? Join us on social media platforms, engage with us, and learn more about this, as the year is still very fresh. Now, Dr. Elisa,
Yes,
what are some of the challenges that you've seen with women before they consider preconception? What happens if a woman does not take preconception serious?
Okay. Thank you very much, Mr. Kamara. So, if the woman doesn't take that serious, as I've said, she hasn't screened for the necessary infections, and now she conceives. So before you know it, the pregnancy is 3-4 months, and it has come out. She has had a miscarriage. And why? As we check around, we find that she had a pre-existing what? Infection. If she's diabetic, if she's hypertensive, all these can affect the baby if she actually conceives. So they can either cause the baby they can either cause high miscarriage, they can cause the baby not to grow well inside, and eventually you can even have a preterm birth for this baby. So if the baby even manages to go up to term means finishing the 9 months, sometimes you are going to find that a baby is born with some, what we call congenital defects, or some problems with them. It can be on the heart, it can be inside their system. Now, what caused that? Maybe the woman was taking some drugs, which for her chronic disease, but which affect the baby. Instead, if you had come earlier, I would say, okay, you need this drug, but we can adjust it, or we can substitute it with another drug, which is safer for the baby. Or we've checked your blood, and we find that your blood level is low, because actually when the blood level is low, the woman conceives, she goes on, she can even have very severe complications during birth. Because if a woman is anemic, her blood level is low, she can't produce, and she develops complications like what we call postpartum hemorrhage. She bleeds a lot, and that's one of the causes of actually the death of our women when they are delivering. So all these complications are going to come up if a woman actually did not go and have this preconception care.
Excellent. Thank you so much, Dr. Elisa. Now, we want to explore now why gynecological routine examinations or screenings are very important, given the rise of gynecological cancers that Dr. Elisa is going to stress about. He's going to give us a few examples and, of course, encourage women why they should go, even irrespective of no sign or symptom or pain, why you should go and see your gynecologist.
Yes. Thank you very much, Mr. Kama. Yeah, I think as the women, as you make resolutions for this year, one of the resolutions you
as
should
they
make,
pray and swear,
as you pray and all these other things, please, you put part of your resolution as visiting your gynecologist, at least for checkup. Even if you feel nothing, can you say, at least this year, I'll visit my gynecologist at least once? Because I know men are going to come when there's an issue, when there's something disturbing her. But at least purpose that I'll go and visit my gynecologist, even when I feel healthy and I feel there's no problem. Why? Because as you've talked of gynecology cancers, it's very unfortunate that most of these cancers, there's something that can be done to prevent them. Or they can actually be detected early and somebody has proper treatment to the extent that the cancer is completely cured. Unlike when somebody comes in the late stages. Now imagine a cancer like cervical cancer, which is the commonest cancer we have here in Uganda. It is very unfortunate that our studies show that 80% of the people actually come when they're in stage 3 and stage 4. And these are what we call the late stages. Imagine if you come in stage 1, stage 2. There's a lot which we can do. Yes, we try to do our best, stage 3. Stage 4, there's really not much. We are basically doing a lot of palliative care, trying to prolong your life. So I want to appeal to the women out there. This year, can you make a plan and say, in these first few months, at least I should go and screen for cervical cancer? If I've not screened before in the last 3 years, can I go and I screen for cervical cancer? Because in some of these places, actually even government facilities, this is free screening, no charge at all. But even in the private hospitals where it is done, it is at a very cheaper cost. So purpose for your life to go and have a cervical cancer screening. Because in the early stages, this cancer may not show you any sign. So it will be there, you see nothing, you think you are healthy, but in actual sense, the cancer is what? Is advancing. So it will be very good if you say, I will go and see a gynecologist and they will screen me for cervical cancer. Now, for the parents that have girls that have made 9 years, between 9 and 15 years, at least can you take your daughter for vaccination? Because the virus that the virus which causes this cervical cancer is called HPV. And then we have vaccination, which has come up. It has been there for the girls. And it started, government started it in schools and all that. So if you love your daughter, it will be a good thing if you took them this year. She has made 9 years, she's 10 years, to be vaccinated. Because once she's vaccinated and you have protected her from this HPV vaccine, because you don't know how her life will be thereafter, then that means you are protecting her from cervical cancer. So that is also an appeal that I'm making to the parents. Now, yes, cervical cancer, but we have other cancers. We have breast cancer. And that one is even much easier for the women to check themselves, because we say do self-breast examination. You are in the shower, you are in your bedroom, can you do a breast examination on yourself? In case you are feeling anything not familiar, any lump there, can you run to hospital? But even before you feel that, it should be a routine that, you know, a woman checks her breasts every day. Or she will come to the gynecologist as well to have these examinations done. So that, because breast cancer is also another one which is really coming in there in our country and killing very many women. And once it is there, the rate at which it progresses is really very high. So it would be better if you screened, and in case we find anything suspicious, we give you treatment early so that we do not have these cancers killing many of our people here in Uganda.
Excellent. Thank you so much. And of course, before we go for a short, quick break, I want us to talk about very small highlights about family planning. Just give us a highlight on family planning. What should we consider for family planning and why family planning is very important? That's the major information I want to hear about.
Oh, okay. Thank you very much. Family planning, because what is family planning? A couple comes together, they plan if to have children or if not to have children. And if they are to have children, when should they have the children? How many should they have? What is the spacing in between? That is family planning. But of course, you hear so many myths, and then family planning is bad and all that. Because what people know is, they are going to take pills. You know, they are going to inject me, give me these injections every 3 months. But we also have natural family planning, where, you know, the woman will follow just her menstrual cycle. We teach them these are the safe days that you can use. We have so many methods. Condoms are a form of family planning. We have what we call the implants. We have what we call the IUDs. We have the tablets, the pills that they swallow. So me, I would really, as you start the year still, whether you have children or you do not have, it would also be a good thing. I have my little son. I have my little daughter. When do I want to have another one? Because it's going to help you as a parent to plan for them. Surely, if you have very many young children, one is 1 year and a half, the other one is 3 months, the other one maybe is 7. Surely, I see a lot of stress on the mother. I just see my little daughter there, just 8 months. But you know the way she's active and all that. I imagine if there are 3 there, you know, not well spaced, they will cause a lot of stress on the mother, you know, and that stress resulting into depression. And of course, if there is proper spacing of the children, even in terms of the needs that they need, basic needs, really, they are going to get the care which you need to give them, the love which you need to extend to them is going to be really, really very appropriate. So I would encourage people, I would encourage the women, of course their husbands, to think of this. You know, some people, even some for religious reasons, some for cultural reasons, they would say, family planning is very bad. You know, they have all these myths. It will cause you cancer, it will cause you this, which are not true. But I think family planning, even if you delivered 6 children, but if they are well planned for, they are well spaced, the children will not get malnourished. You will not get these repeated miscarriages and all that, because, you know, somebody has just delivered, they're not well prepared, the body is not well prepared, you know, and then, you know, all of a sudden they conceive, and maybe they are still even anemic, and you find that somebody even has a miscarriage just because of that. So I think proper spacing and planning for the family should be one of the resolutions for us this year. Very important.
Wow, thank you so much, Dr. Issa. And of course, we're going for a short, quick break, but when we return, we shall discuss more of these wellness tips here, Health and Beauty program. Do not leave our station.
Gugude TV, transforming your life.
In the neighborhood, near stagnant water and mosquito breeding sites, malaria lurks, always waiting to strike. But fear not, for here comes Mr. Vaxxer. the ultimate protector against malaria. For years, malaria has been one of the biggest threats to children under 5, making them weak and even putting their lives at risk. But now, the government is introducing a new solution, the malaria vaccine. The malaria vaccine is now in the routine immunization schedule. The malaria vaccine is administered in 4 doses. At 6 months, 7 months, 8 months, and 18 months. This vaccine will provide extra protection against severe malaria. And don't forget, routine immunization protects children from many deadly diseases. Every vaccine matters. Visit the nearest health facility for routine immunization services today. Mr. Vaxxer, the malaria vaccine is free, safe, and ready to protect our children. Will you join the fight and complete all 4 doses? For more information, call the Ministry of Health on 0800 100 066. This message is brought to you by the Ministry.
Good Day TV, transforming your life.
Again, you're most welcome to Google Data Vision Health and Beauty program every Wednesday at 9 p.m. This is 2026, the very first program. I am Kamara Daniel, your health presenter, and of course bringing to you Dr. Lisa Rumara, who is an obstetrician, gynecologist, and a women's health specialist, discussing the women's health tips for the year 2026. And of course, he's also bringing new resolutions. Sometimes you can have many resolutions of getting married, buying a car, buying a plot, constructing a house, and so ever, but you forget about your health. And he's bringing very important questions to your resolution. Please get your prayer request notebook, add it there, pray for health, but also add checkup, even when you're healthy or not. Now, Dr. Lisa, quickly drive us into the discussion of menstrual hygiene. We have young girls this year, and of course every woman does so, but let's talk about menstrual hygiene.
Okay, thank you very much, Mr. Kamara. Menstrual hygiene, because first of all, the viewers there need also to know, those who may not be known, what is menstruation.
Please do.
What is menstruation? This is a cycle that women go through from the time they are girls. They go through every month. So they have monthly bleeding. Where does that bleeding come from? It comes from their, what we call the uterus or the womb. Of course, I've heard people say, now if that blood doesn't come out, won't it pile inside there? But it's a whole cycle that goes through, you know, some layers growing into the woman's womb, and then later, because all that is in preparation for the woman to conceive, for the womb to carry a baby. So if the baby doesn't come, then that layer is shed off, and that's what comes out as what? As blood. So we expect women to start, as girls, to start this menstruation. Averagely is around 12 years. So from the age range of actually 9, some 10, up to around 15. So we expect that a girl has started her menstruation. Now, if you have your daughter there and maybe she comes earlier, that will be a little bit outside the normal. But again, if it goes beyond 15 years, 16, then that menstruation has delayed. The start of the menstruation has delayed a bit. So that means still you need to see a gynecologist to find out why. Menstruation, women or girls actually experience it differently. Some really go through without minimal difficulties, but some really have a lot of difficulties. Some it may be a lot of bleeding, really excessive bleeding, but some it may be painful periods, really very, very painful. And what I want to tell to, the viewers there that this menstrual pain should never be normalized. Your daughter should not be going through a lot of pain, or you, just an adult, going through a lot of pain and say, okay, this is normal, let me take a lot of painkillers and all that. No. You come and see a gynecologist because we may be having an underlying condition. And now, as you said, to the tips, menstrual health, of course, the women telling to, especially the girls, you need to prepare your daughter prior to that, you know, as she grows up, and you know now she's making like 9 years, she's making like 10 years, to start these health talks to her. Okay, now, you know, there's this that girls go through, or us as women go through, you need to be prepared for it. And when it comes, it shouldn't be as a shock to her. She needs to have already psychological preparation. But now when the bleeding is on, of course now with our modernity, we have the pads, which are there for the girls to use, for the women to use. And as I said, the bleeding actually varies. Some women may bleed for 3 days, others may bleed for 5, but also the amount of the bleeding varies. For us, we say if it is between 30 to 80 mils, that's normal. If it goes beyond, because there are really people who come and tell you that now we come with blood clots and all that, and then they even get their hearts racing after that period. That means they've even become anemic. They are dizzy, they lack energy. But we should have the pads with us. The women should have the pads. The girls should be given these pads to carry along with them. And also, depending on how your bleeding is, it will vary. There are people who use a pad, just 1 pad in a day. That means it is really not that much. It is slight bleeding. There are those that may need 2. But for many of them, you may find that within 4 to 6 hours, they need to change a pad. So that is very key. And also, of course, during that time, we discourage the use of tampons, getting maybe clothes, folding them or towels, and inserting them down there, because they are going to be a source of infections, which will actually now cause other problems. So the pads are okay to use, changing them regularly, depending on how your bleeding is, but also, of course, maintaining the other hygiene, the showering and all that. But as I say, yes, you shower, but still we discourage the use of soaps. You know, using soap and trying to clean down there. I've even seen, of course, some other things say, okay, you can put this, but it's not also encouraged, because that system down there for the women, God gave it a natural cleaning mechanism. You do not need to get your soap and put inside there that now I'm cleaning. No. God has given it a natural cleaning mechanism. It will clean itself inside. So long as you shower well, keep on changing the pads, and of course the girls who are starting, educating them, preparing them, so it doesn't come as a shocker to them, and maybe they start getting any other advice from outside which may not be really appropriate. Yeah, so.
Excellent. Wow. Thank you so much. Of course, you've fully shedded more light about menstrual hygiene, what it means, and of course when people should expect this. And now we want to talk about the sexual health, the common sexually transmitted diseases, or the common disang about the UTIs and so on. Just give us simple clues about them. When should they seek help? How do you know, why are they important to seek medication early and review in time? And what are the likely complications if they do not come in time?
Oh, okay. Sexually transmitted infections, actually, these are very common. And as you asked me in the beginning, these are some of the reasons why women come to see a gynecologist. And still, I would advise that let it be part of those things you want to go and see a gynecologist, even when you do not feel symptoms. The worst part of these sexually transmitted infections is that they can actually, at a big part of them, they may be what we call asymptomatic. You will not have any sign, any symptom that you have a sexually transmitted infection. Until now, you may get complications out of them. So there are quite a number, but commonly we have what we call chlamydia, we have gonorrhea, we have syphilis. These are commonly known, but there are even so many others, you know, hepatitis and the rest. But these are the common ones. Now, of course, signs will come and show, like discharges, like itching, maybe when a man is with a woman, they having pain. But as I said, some of these, many of them are not going to show any signs. So it will be a good thing to go and see a gynecologist, to just say, no, let me screen for some of these sexually transmitted infections. And there are people who say they are a little bit at a high risk. If, for example, you have more than one sexual partner. So it would be a good thing. You make it a routine to have this screening with you. But more so for the preventive part, if really you can't keep one partner, can you use some preventive measures like condoms? Because they are one of the things that we know that can help you to prevent this transmission of the sexually transmitted infections. Now, STIs are sometimes confused with the UTIs, sexually transmitted infections, urinary tract infections. So sometimes when I'm treating a woman for a urinary tract infection, she says, but now you're not treating my husband to give me these medicines. But if it's a urinary tract infection, it follows a different system from a sexually transmitted infection. So a urinary tract infection cannot be sexually transmitted. That's why I will treat you, maybe you use the bathroom somewhere and you acquired it. So if I treat you, I don't necessarily need to treat your husband. Unless I think, okay, this could be a urinary tract infection, but maybe there is some underlying infection in there. That's when I will say, okay, you get the treatment and also let me give your husband. So sometimes you have those a little bit of
controversies.
Yeah, controversies in the consultation room, and the woman say, I have to take for him. I think he's even the one who brought this infection. But until you have to, to advise them and tell them, no, this is a urinary tract infection. You don't have to worry that you spread it to your husband.
Wow.
Yeah.
This is interesting, and of course I'm learning lots on what to do in the year 2026. And of course, we want to once again encourage you to visit our social media handles, Google Data Vision Uganda on LinkedIn, Facebook, TikTok, and go ahead and share your comments, but also on X, or formerly known as Twitter. So, Dr. Elisa,
yes,
what are some of the common challenges away from what you've talked about that you think women should pay attention to regarding their health and lifestyle, overall health and lifestyle? Of course, we have the skin, whatsoever, pimples, what. Talk about, highlight other areas that you as a gynecologist, away from the down parts that you've seen.
Yeah, of course, for the general part, which actually you also encourage us, the nutrition part is very key. It's for all of us, but the women also, we need to encourage them. Any woman, especially reproductive age, you are even planning to conceive, as we said, you need to keep healthy. Even without that, you need to be healthy. Now, exercises are very important. Exercises should not be left that, yes, it is the men who need them. No, they're important, both for our reproduction, but also for the woman's health at large. Because exercises, if you are not doing them, if you are not eating well, and of course eating well now is chips and what, and all those fries.
The sweet potatoes, beans, those are for the poor.
Exactly. And the good thing, my expert here, my brother is here, we will always advise us. So if a woman gets too big, let me say obese, that alone actually can also affect her menstruation. Yes, it will affect her menstruation. She can actually now get months without her menstruating. And that means it will affect her fertility. If she wants to conceive, then sometimes we are going to have problems. If she's hypertensive, still, if she conceives, then we shall have some issues with the pregnancy. So I encourage the women, on top of the screening, let's maintain a healthy lifestyle. Let's eat a balanced diet. Let's eat fruits. Let's do exercises. Maintain a manageable weight. you know, because all these are going to be key for you and important for your health. But also something, because when we talked about the STIs and what, something I need to mention is, because you asked me about the complications, which I hadn't mentioned, is the infertility.
Please.
Infertility. Because a lot of this infertility has come from these sexually transmitted infections, especially in the women, because once they are there for a long time, they are going to block the woman's tubes, the fallopian tubes, and that means the woman is going to become infertile. And surely, as a resolution, if you've been trying for the last year, 2025, to conceive for the whole year, and you've not conceived, you've been having regular sexual intercourse, the husband is there, the wife is there, and you've not conceived, but you were intentionally wanting to conceive, this is the right time. This month of January is the right time for you to come and see a gynecologist. Not again to say that, let me try this year and see what is happening. No, because now already we say there could be a problem. So I just wanted to pass on that message also, that please run very fast and see a gynecologist as a couple. Because if there is some small problem, it is going to be fixed easily than when you prolong this problem for another year or two. So I encourage those couples to please come and see a gynecologist.
Wow, wow. And of course, just to know, we are learning and we are doing all this together, because we are learning about women's health and wellness package for 2026. And we are speaking to an associate consultant, yes, and he's a women's specialist, and for over many years back he has treated women and managed women's conditions. Dr. Lisa, there could be some women who have chronic diseases, especially related to the sexual part, and there is an issue of self-medication. It's the point I'm driving to. Maybe they have treated it over a year, but the problem is recurrent. Talk about self-medication and the recurrence of diseases.
Okay, thank you very much, Mr. Kamara. I think this is a very big problem for us here, especially in our countries, what we call the low-income countries, where there is really limited regulation. If you go to some of those other Western countries, there's a lot of regulation, in that you can't easily get an antibiotic without a doctor's prescription. And that means the doctor has made a diagnosis and given you the appropriate medication. But now, since we have so many outlets there that are selling medicines, somebody could have suffered from a condition, as I've said, a urinary tract infection, because these are actually some of the recurrences that we have. So many women coming back with recurrences. I was treated 2 months ago. I was treated for Candida 6 months ago. Now it has come back. Why? They gave her the medications. She got cured. But now, if she gets this infection again, instead of going to see the doctor or even seeing a gynecologist for the women's condition, she will say, no, but I saw the medicine which they gave me. Let me go and buy the same medicine. And what is going to result from that is what we call drug resistance. The drug will no longer be able to act on those particular infections or that particular disease condition. And that means the disease is just going to persist in your body, and it will just begin advancing and causing you complications. So I want to appeal to people out there, please, let us avoid this habit of self-medication. Because yes, drugs are good, but if they are not appropriately used, they are actually going to become dangerous or harmful to our bodies. So it's a big problem which has resulted into drug resistance, which we are actually fighting with. But this starts with us, the people. Do not fear to go to a doctor, because I know some, of course, say the doctor is going to ask for consultation fee, maybe 5,000. Instead of that, let me buy the medicines. But that is going to save you from a very big problem, because actually, to talk about these infections, some of them we have had to do what we call a culture and sensitivity. Why? We either take off your urine, if that's the sample we need, or blood, and we have to go and find out which exact organisms are these, which infections are these, which kind of infections are they, because you have been treated, and I see many women, they have been treated from 6 clinics, and then eventually they come. But they say this thing is not going away. Why? Because you overused all these medications to the extent that now the germs are inside your body just laughing at you as you send in these medications. So please, I just encourage, let's avoid that, and always seek medical advice from a healthcare practitioner who will advise you, make a proper diagnosis and a proper prescription for you to avoid drug misuse.
Excellent remarks from Dr. Elisa Rumara, a gynecologist and an associate consultant. And of course, you've learned a lot regarding women's health and wellness for the year 2026. But as we intend to wind up this very important discussion, let's talk about the use of artificial intelligence, the use of AI and Google to treat themselves and also manage different health conditions. Talk about the use of AI and social media.
Yeah. So you see, technology has many advantages, but also comes with issues. Now with this technology, surely, I rarely see a woman who comes to the office or to the consultation room and has not researched about their disease. It is now not common. Now, that is very good on one hand, to go and Google and ask AI to tell you, give you some information. But of course, some of the information that you may get, it may not be easy for you to interpret if you are not a medical personnel. Or you may also misinterpret it. So it is not bad to read through and come, because I also get challenged. So as I'm discussing your illness, the condition, you tell me, but also I read this, and I'm happy. I say, okay, that is this. But maybe here it is not very accurate. It is this. And then you say, oh, but the worst bit is now to use AI to say that AI has become my doctor. Or Mr. Google has become my doctor. So it is very bad to come to a gynecologist or to any doctor and say, doctor, yes, I felt here, I was feeling pain, but when I Googled, they told me when you feel that pain, maybe you have a liver problem. So, but these are the medicines you can get. So sometimes somebody comes with a packet of medicines and has already started taking. I have taken for 5 days, but I don't feel any change. And now that is a problem, because already the medicines you've taken, they may actually be harmful to your body. And now we have to undo that. So it is good you can read, then come, when you're also informed a little bit. But we have a discussion, and the final treatment should come from the doctor, not from Mr. Google or from AI.
Wow. Yes. Thank you so much, Dr. Elisa. And of course, we want to thank all the viewers who joined us at 8 till now, of this point when we want to conclude this very important program. 2026 is here for me and you. Do you have any conclusive remarks, just in 1 or 2 seconds? Yeah,
my conclusive remarks, please, women out there, don't be there and suffer in silence. I have this issue, I have this problem, and you keep it back. You know, the symptoms are there, and you are not coming to hospital. Please, you come to hospital. Let screening be part of you. As we've said, cervical cancer, breast cancer, and all the rest, let it be part of you. And once these illnesses are detected early, then we shall have proper treatment. As I've said, the women, you are the backbone of our society. So we want you to be very healthy, because we know that's the only way we are going to develop our society. Excellent. Thank you so much, Dr. Elisa. Women are the backbone of the society. In food security, we say women are the food security providers. And of course, we want to thank you for watching the Vision Time Beauty program. This is the very first program of there. We want to wish you the best. We want to urge you to keep praying, but also minding about your health of this year, 2026. I'm Kamara Daniel. Hope to see you next week. Bye-bye.
Good Day TV, transforming your life.